You're watching Wellness Watch on DD India, your weekly dose of wellness and good health. We all want a long life, but more importantly, a healthy one. We often panic over a cough or a cold, but what if a fever is not just a fever? What if it is a warning sign from the most powerful organ of our body, that's the brain? High fever, headache, sudden seizures. Now, these are not just random symptoms. They could signal encephalitis, a serious inflammation of the brain that demands urgent attention and can alter lives within hours. Today in Wellness Watch, we discuss encephalitis. I'm Preeti Kaur. High fever, sudden confusion, seizures without warning. What may appear like a severe viral illness can in some cases be something far more serious, that is encephalitis, a condition that causes inflammation of the brain. Every year, World Encephalitis Day is observed on February 22nd to raise awareness about the serious and potentially life-threatening condition. It can affect anyone at any age and may progress rapidly. Here's a report by DD India's Harshita Oberoi on what is encephalitis, how it is identified and treated, and why awareness is critical.
Encephalitis is a serious life-threatening condition caused by inflammation of the brain. It occurs either when an infection directly invades brain tissue or when the immune system mistakenly attacks the brain. In some cases, the exact cause remains unknown because the brain controls vital functions. Inflammation can quickly become dangerous. The early phase may resemble the flu, but symptoms can intensify quickly. Common warning signs include fever, headache, body aches, and fatigue. As the condition worsens, symptoms may include confusion, personality changes, agitation, a stiff neck, speech, and even movement problems, along with seizures and loss of consciousness. In infants, the signs may include a bulging soft spot, vomiting, and even poor feeding. A useful acronym to remember is FLAMES: flu like symptoms, loss of consciousness, acute headache, memory problems, emotional or behavioral changes, and seizures. Recognizing these symptoms early can be life saving. There are two main types of encephalitis: infectious encephalitis, which is caused by viruses, and rarely bacteria or fungi. Autoimmune encephalitis, in which the immune system mistakenly attacks brain cells. Both forms can affect people of any age. Common viral causes include the herpes simplex virus, enteroviruses, West Nile virus, Japanese encephalitis virus, and tick-borne viruses. Not everyone infected with the virus develops encephalitis, but certain factors increase vulnerability, including a weak immune system, very young or older age, and exposure to mosquito or tick-borne viruses. Complications can range from prolonged fatigue and memory problems to personality changes, coma, or even death. The severity often depends on how quickly treatment begins. Confirming encephalitis requires multiple medical tests. These may include MRI or CT scans to detect brain swelling, a lumbar puncture to analyze spinal fluid, blood tests, and EEG to monitor brain activity in rare cases, a brain biopsy. Body scans may be required if an autoimmune cause is suspected. Early diagnosis is crucial for better outcomes. Treatment is tailored to the underlying cause. Antiviral medications are given for suspected viral infections. Steroids or immunotherapy are used for autoimmune cases. Anti seizure medications and supportive hospital care often required. Severe cases may need breathing support and close monitoring in intensive care. Recovery varies widely. Mild cases may improve within weeks. Severe cases may require months of rehabilitation. Speech, physical, and cognitive therapy may be necessary. Some people recover fully, while others may face long term neurological challenges. While not all cases can be prevented, the risk can be reduced. Stay up to date on vaccinations, maintain good hygiene, protect against mosquito and tick bites, and seek prompt medical care for severe symptoms. When it comes to encephalitis, awareness and early action remain the strongest defense. Harshita Oberoi's report for Wellness Watch, DD India.
All right, so encephalitis is a serious, life-threatening neurological condition characterized by inflammation of the brain. It is a major neurological burden, particularly in children under the age of 5. Globally, it affects 3 people every minute, yet almost 8 in 10 people do not know what it is, leading to dangerous delays in diagnosis and treatment. In 2025, the World Health Organization released its first ever technical brief on encephalitis, recognizing the condition as a growing global public health threat. India has recorded important gains in the prevention and management of encephalitis over the past decade, but experts caution that progress has been uneven and delayed recognition and diagnosis continue to result in preventable deaths. Today in Wellness Watch, we look for these answers. What is encephalitis? What are the types and stages of the disease? How is encephalitis caused? Is it fatal? We also look for medical advancements in India in the field. Encephalitis treatment in India focuses on immediate hospitalization, supportive care, fluids, fever management, seizure control, antiviral medication, and corticosteroids to reduce brain inflammation. Severe, particularly viral or Japanese encephalitis requires ICU monitoring. For autoimmune cases, therapies like plasma exchange are used. Up on your screens, we have some hospitals and institutes that specially cater to this. All India Institute of Medical Sciences, Delhi. Institute of Human Behavior and Allied Sciences, Delhi. National Institute of Mental Health and Neurosciences, Bengaluru. National Institute of Virology, Pune, Maharashtra. Postgraduate Institute of Medical Education and Research, Chandigarh. To help us understand encephalitis better, we're joined in by specialists in the show. We're joined in by Dr. Manjari Tripathi. She's Professor and Head, Department of Neurology, AIIMS. She's joining us virtually. We're also joined in by Dr. Naresh Gupta. He's Consultant Physician and former Director and Professor, Maulana Azad Medical College, Delhi. Thank you so much, both of you, for joining us this afternoon. Dr. Gupta, to begin with, what is encephalitis? Specifically, which viruses cause it?
See, Preeti, as you said in your report, encephalitis is what we loosely call swelling of the brain. Once there is an inflammation, one of the hallmark is swelling, and that disturbs the function. The problem with the brain, unlike other organs, is brain is encased in a solid bone, and brain cannot expand if there is a swelling coming up. And if the swelling comes up, it compresses and puts pressure on very vital or vital controlling centers in the brain. So, the swelling of the brain that occurs generally is called encephalitis or encephalitis. Now, if there is a inflammation with it, we call it encephalitis. Sometimes we find same thing occurs without any inflammation or infection, then we can call it encephalopathy. So, encephalitis, the common cause that we are referring to is virus, and acute viral encephalitis has become a standard term. The reason being, it affects very vulnerable population, this acute inflammation of the brain. Small children who can't even complain, you have to really find out, and hence there is a delay in diagnosis and there is a delay in treatment and a very high mortality. And the other part is this kind of a inflammation, the viral inflammation of the brain, is actually going up, increasing with the passage of time, and it has something to do with the environment and the climate. We are finding new and new viruses attacking different states and causing viral encephalitis. Having said it, this acute viral encephalitis also is to be kept in mind when we are thinking of systemic diseases. So, there is a systemic viral encephalitis also, which happens once there are very widespread systemic diseases that tend to occur in more older persons. Finally, there are some toxins, we speak of the environment, and many of these toxins that come from the environment can also cause similar encephalitis. So, the domain is much bigger, but I think the stress, the focus is on acute viral encephalitis because of the mortality and possibility of prevention and bringing the life back to normal.
All right, at this point, I'll bring in Dr. Manjari in. Dr. Manjari, in very simple, common layman terms, I would want you to explain to our viewers what is the difference between encephalitis and epilepsy.
So encephalitis is an acute condition which results from exposure to a virus, and it produces fever, headache, vomiting, seizures, and altered sensorium. That is, the person becomes unconscious. And this can be fatal if left untreated because there will be increased in intracranial pressure in the brain. The seizures it produces is acute symptomatic seizures. That is, they are provoked seizures provoked by the acute or sudden brain infection. Whereas epilepsy is the occurrence of two or more unprovoked seizures. So there will not be an immediate, within 24 hours, within 7 days, history of any fever, headache, and vomiting. So any fever, headache, and vomiting, and within 7 days, seizures happening is likely to be an encephalitis causing provoked seizures, and unprovoked seizures where there is no fever, headache, and vomiting, but two or more seizures is epilepsy.
Right. Dr. Gupta, help us understand. You told us about the types of encephalitis. Help us understand the stages as well.
You see, encephalitis is a spectrum, as we were also hearing. 8 out of 10 don't even come to know. So there is a viral infection which goes into the body, takes some days to show up, and then it might go away without causing any problem.
Right.
So that is the time when nobody suspects it, and many of them get away with it. You can call it, early stage or stage 1. And then you can have the inflammation which is coming up with such a big storm that it endangers the life also, because the brain is a very critical organ and the swelling coming up much bigger. Now those are the ones that cause need hospitalization, and in between there is a spectrum that we can catch up.
All right. Dr. Manjari, when we talk of the first signs, when we talk of the symptoms, what are the first signs that one should look out for when we're talking of encephalitis? And added to that, sir did mention that if it is in the first stage, the symptoms go away on their own. But then when is it the time to seek expert medical help?
Any child or any, adult complaining of fever which is high, followed by severe headaches, followed by vomitings, which are occurring one after the other, and followed by, becoming dull and the senses becoming, drowsy. And then from drowsy state going into complete altered sensorium with seizures. One must think of encephalitis, and usually this occurs within 24 to 72 hours. So, and rush the person to the hospital because there are several causes as was listed out. And, we have to do the CT, we have to do the lumbar puncture, we have to send the pan-viral serology, we have to send the tick serology. There are a number of blood tests which need to be done, and the treatment needs to be started immediately. So fever, headache, and vomiting with gradual decrease in sensorium and seizures is encephalitis. Otherwise, until proven, please take the patient to the hospital. Don't wait for a week, 10 days. And we know there are certain very treatable encephalitis like herpes encephalitis. The treatment has to be started as early as possible, well within 4 days. If you delay the treatment to 2 weeks, the patient is not going to recover. The patient is going to remain vegetative and have a lot of neurological disability.
All right, Dr. Gupta, when we talk of encephalitis, which age group is more prone to encephalitis? You tell us that even children and elderly grown-ups, they are infected by encephalitis. But is there any particular age group that is more prone to it?
See, usually we would expect the children and the adolescents. They would be more prone, and amongst them it is the children and the elderly. Both of them have got a weak immune system. The children are still trying to develop their immune system, and the elderly have done away with it. They have accumulated so much of baggage over the years that the system gets weakened. So these viruses tend to be occurring in the environment. Actually, two-thirds of these viruses actually are related to the zoonosis. That means some animal that we maintain or we don't even maintain, they come through them. They are the factories which keep producing them in larger numbers. So when these viruses are there, they are everywhere. But those vulnerable groups would be the children, small children particularly, and that is where we have the emphasis, because the deaths from acute viral encephalitis is running about 10,000. I think it's about 16,000 per year now. So 1,000 per month dying in India is a big number. And that's the other reason is these are the children who can't even come out with So if somebody does not recognize that headache or vomiting, as Dr. Manjari was saying, vomiting is a very important showing up feature for virus causing the encephalitis in small children, and so also the elderly. Having said it, we see this viral encephalitis all along. So there are these immune mediated we see in the adults, we have these organophosphorus we see in the adults, we have these malignant ones that we see in the adults, we have these other infections are coming up which are non-viral and which were not kind of very well seen in the perspective of surveillance, and those are these scrub typhus that we are seeing in Tamil Nadu and Gorakhpur recently. So those are coming and they have a treatment. Some of the viruses have treatment, many of the bacteria have treatment, and all parasites have treatment. So everything has treatment. So we must say that nobody is immune, but particularly prone are the small children, pregnant ladies, and elderly, and those who are on some immunosuppressive drugs like cancer or some joint diseases.
All right, Dr. Manjari, how long does it take to recover from encephalitis? Can it be cured completely? What are the chances of its recurrence?
Absolutely. So if the treatment is available and if the treatment is sought within 4 days of the symptom onset, so for example, we have for rickettsial as well as scrub typhus, which causes encephalitis, we have doxycycline, we have amoxicillin, we have cefuroxime. So there are antibiotics which need to be given immediately, provided you suspect it and you look for the tick bite and you treat it immediately. So it can be transforming. The person can walk home. If the person has herpes encephalitis, we need to give acyclovir intravenously immediately. And again, it can be transforming and the person can walk home. For Japanese encephalitis and other encephalitis, we need to start anti-edema measures which reduce the swelling of the brain. Usually these are steroids and mannitol, and we also need to give them anti-seizure medicines to stop their seizures, because with every seizure, the swelling in the brain worsens. We need to hydrate them. We need to maintain their nutrition. And if they have come in early, then there is a chance that they will not have too much of neurological disability. But if they have been brought in late and the diagnosis has been delayed due to whatever reasons, then 30% of them are left with a significant neurological morbidity in the form of, the cognition or the mental status declining. So their intelligence will not be the same. They may not be able to swallow, so they may be on tube feed for very, very long. They may have stiffness, which is known as tonic positioning, or they may have twisted positioning of the body, which is known as dystonia. They may also have weakness of one side of the body, and they may not recognize the world around them. So they become vegetative or they become disabled. And that is precisely why prevention is the key for any encephalitis. And that is something which needs to be taken care of when the children are at school, when the children are at home, when the children are playing. The prevention which is of great importance is prevention against mosquito bite, which are vectors for these diseases. So mosquito bite, you need to wear full sleeve shirts, or a skirt and pant dress rather than short skirts without anything on the legs, or short sleeves. You need to have clean environment where there's no waterlogging, especially stagnant water. You need to make sure that the schools are not near rice fields where there are pond herons, or there are a lot of bovine, that is basically pigs and other cattle around, where which are the amplifier hosts for these viruses. And we also need to make sure that there is no the children don't go into dense vegetation, which is where the ticks attach themselves to the kids. So basically you need to work on prevention at war footing. Every school must be made safe against encephalitis, either the vector breeding there or the amplifier host breeding there. So, you need to be very, very stringent about your cleanliness, water pooling. You need to advise children to wear full sleeve clothes, as well as, you should be spraying DEET around, so that the vector is not, proliferating. So these are, I think, more than focusing on the treatment, we as a country should focus on prevention. And simple things go a long way. Yeah.
All right. So, Dr. Gupta, ma'am has very aptly explained to us the preventive measures that have to be taken, the preventive care and the precautions that need to be taken. But acquaint us with what medical advancements have been made in India with regard to encephalitis.
You see, if you look at a larger perspective, the national perspective, we also have to make sure that we catch them before they attack us. And that is where the surveillance comes in. We have a national vector disease control program under which they are doing surveillance. Now, the surveillance is covering active surveillance, or rather aggressive surveillance is covering almost half of the districts, 355 districts they are covering. Now, doing this surveillance will catch them young, and they have been very apt on this. And the other area that where they are working on is, as soon as you come across a case, index case, you highlight it and you bring in measures for population population control of the disease. For example, this year we had these 2 cases of Nipah virus that were highlighted.
Yes.
Now, Nipah virus earlier on probably were not even thought about or diagnosed here. Now, we have full diagnosis, confirmed cases which we can send to anywhere and everywhere. So, we have these Nipah virus that are showing up. The year before that, that means last year 2025, we had these outbreaks that occurred in Assam. So, that was this Japanese encephalitis which has been known for decades in India, but almost half of the workload happened in Assam that time. So, this is where the focus was, and before that we had the Chandipura virus,
yes.
Which caused a lot of mortality. Even though it used to be in Maharashtra, this time it was Gujarat. So, when you identify them, then you can come out with mass protection
Yes.
programs, not only the individual ones, but the mass protective programs. Then there is also a development about the Japanese encephalitis, which is a huge problem anywhere. There is this vaccine against the Japanese encephalitis, 2 doses, and it has been incorporated into the universal immunization program. So, all the children, it is not only incorporated into the universal immunization program, but all the children who are 1 year and 2 years, 9 to 12 months in, are given this dose along with the other vaccines. And there is also a stress that these are occurring not in isolation, but they are occurring along with other infections also. So, if we have dengue and chikungunya,
Right.
many of those cases, even though they are primarily viral infections affecting the rest of the body, rest of the systems, but many of them come to us with encephalitis also.
Right.
So, they are not in isolation, the toxic ones are there, these leachy things come up. So, all these things keep coming up in several areas, but when they come up, they tell us one thing, that the focus of, I really admire this focus of Bharat Swachh Abhiyan. If you Swachhata Abhiyan. Now, Swachhata Abhiyan is such a big thing for medical science, including viral encephalitis and many other diseases that it brings in. So, the focus is that you try to emphasize, and of course, the media does it, you do it, commemorating the national days for many diseases. So, there is infrastructure which has come up for the diagnosis of these viral disorders, including viral encephalitis, which was not there until some time earlier, but now we saw during the times of COVID, every nook and corner had this diagnostics. We need to strengthen the viral diagnostic for, molecular diagnostics for other infectious diseases in a bigger way.
Right.
But I think the progress is very satisfying.
All right. With this, we come to the next part of the show, wherein we'll ask, I'll put some mythbusters in front of you, and I would request you to give very crisp answers. Some doubts of our viewers that will be clear through these myths. Dr. Manjari, only the elderly or weak get encephalitis. Is it so?
No, this is incorrect. Anybody can get encephalitis when exposed to the environment and the infection.
Encephalitis is same as meningitis, Dr. Gupta?
Technically, they are different, and the causes are different, treatment is different, but we must remember that there could be overlapping symptomatology, signs and symptoms.
It only occurs in tropical or specific areas, Dr. Manjari?
Yes, to a certain extent, it is confined to certain locations. However, even though endemic, it can very soon become epidemic in proportions.
It is just a severe headache or fever, Dr. Gupta?
Not at all. One should not think like that. It is much, much more than severe headache. And one should take it seriously.
Encephalitis is caused by vaccines, Dr. Manjari.
No, not at all. Vaccines prevent encephalitis. And we do have Japanese encephalitis vaccine now, which is to be taken in 2 doses. If you are staying in an area or you are going to an area which has a high prevalence of Japanese encephalitis, the vaccine should be taken.
Getting infected by encephalitis is not of a major concern, Dr. Gupta.
It's a serious concern, and I think one should not take it lightly. Even if the symptoms are milder, the disease itself can be causing high mortality and morbidity.
All right, so thank you so much both of you for joining us this afternoon on Wellness Watch and helping us understand better encephalitis and also how severe it can get. So after this discussion, we did understand that encephalitis reminds us of the fragility and resilience of the human brain. It may begin silently, but its impact can be loud and life-changing. Early diagnosis and timely treatment remain our strongest defense because when it comes to brain, every minute matters. Remember, encephalitis progresses fast, but so can recovery if treated in time. On this note, we end this edition. Till we meet next, take good care of yourselves. Bye-bye.